Indeed, I'll try to talk on the emerging evidence linking the environment to psychosis, and I'll start with some of the best evidence, and that's coming from genetics. So very interestingly, if you look at a phenotype like schizophrenia, then we know from twin studies, classical twin studies, that the heritability is in the order of something like 80%. But we know that classical twin studies tend to overestimate the proportion of the liability attributable to genes and tend to underestimate the proportion of the liability attributable to the environment. So classical, more recent family studies, like the one by Paul Lichtenstein in Sweden, published in The Lancet, had an estimate of about 60%. But now, very interestingly, we also have heritability estimates from molecular genetic studies, particularly the genome-wide association studies, where you compare millions of markers, genetic markers between controls and between patients. And these have come up with a large number of genetic variants that appear to be associated with genetic risk for schizophrenia. And if you calculate the heritability based on these genetic marker studies, then the heritability of schizophrenia becomes something like 30%. So as you can see, there's in studies where case control studies, the molecular genetic studies where people are not related, the heritability is much, much lower than the studies, for example, in twins, where the members are very much genetically related. So the evidence suggests, going from 80 to 60 to 30%, this suggests that we seem to have been underestimating the role of the shared environment. Of course, this is a hypothesis, but I think it's a very interesting hypothesis. And there is, of course, evidence from epidemiological research linking something as complex as schizophrenia to a variety of proxy environmental risk factors, like indeed something to do with growing up in the urban environment. We don't know what it is, but it seems to be associated with the risk of developing psychosis, childhood trauma, bullying, migration, and cannabis use. There is at least some evidence that these environmental exposures may be associated with schizophrenia. So this is very interesting. How can we investigate this better? What sort of models do we use, and is it relevant? Of course, schizophrenia is a very complex concept. It is different in ICD than DSM. And the way we tend to see it now is that schizophrenia is the poor outcome fraction of a spectrum of psychotic disorders, which have a prevalence, a lifetime prevalence of about 3%. So this includes things like delusional disorder, schizoaffective disorder, brief psychotic disorder, etc. Lifetime prevalence of about 3%. And then this spectrum also includes things like psychotic experiences that you can measure in the general population, which are associated with things we call schizotypy. So there's a gradient going from a clinical and a clinically relevant and persistent phenotype with poor outcome, which we call schizophrenia, to a broader phenotype of any psychotic disorder, to even a broader phenotype of psychotic experiences, which you can also measure in the general population as traits associated with schizotypy. And indeed, the epidemiological evidence suggests that schizophrenia is, or psychosis is what we call now a trans-diagnostic phenotype. So psychotic symptoms in the sense of delusions and hallucinations are not only present in schizophrenia and schizoaffective disorder, but they're also present, although in a much more subtle fashion, as delusional ideation, subtle hallucinatory experiences in depression and anxiety disorder, in the common mental disorders, where they impact treatment response and outcome, and also is measurable in the general population. So the hypothesis is that this transdiagnostic phenotype is affected not only by genetic factors, but also by environmental factors. Now, the interesting thing of psychiatry, of course, is that when you try to examine something like the environment impacting on a phenotype like psychosis and schizophrenia, then, of course, there's always the two sides of the coin. You can measure the effects of the environment in terms of its impact on biological mechanisms, like epigenetic mechanisms, but you can also measure the impact in terms of psychological mechanisms and the effects on the mind. And I think this is fascinating, particularly since you can't examine them directly, of course, but there is some tendency in the research. This is an old paper by Jean-Paul Selton and Elizabeth Cantor-Gra, suggesting that things like childhood trauma and the effects of migration and urbanicity can be described in terms of chronic experiences of subordination or exclusion. And they call this social defeat, which is very much describing the psychological impact of these environmental exposures over the life course. And some of the evidence associated with this hypothesis is, for example, the results of studies on migration. So there have been many studies looking at individuals who've migrated from a situation where they were in an ethnic majority position to countries like the UK and Switzerland and France and the Netherlands, where they became a minority position. And this is a type of study that has been replicated at least 3 times. Very interesting. This is data from London. And it was a study in London on ethnic minorities from the Caribbean living there. So we observed that in neighborhoods where these minority populations were actually in the majority, so they were in neighborhoods with a high own group ethnic density. The risk of ethnic minority status in such a neighborhood was increased by a factor 2 compared to the white autochthonous population. But then in neighborhoods where there was a medium own group ethnic density, so where the ethnic minority individuals were more of a minority, the risk was higher. The risk of suffering a psychotic disorder was about 3.6. And in finally neighborhoods where there was very low own group ethnic density, the risk was highest, as 4.4. So this tendency of the individual risk associated with ethnic minority status depending on the contextual effect of own group ethnic density has been replicated several times. So it seems to suggest that the more you are different with respect to the context you live in, the more you're different, the higher the risk of schizophrenia. The more you are the exclusion, the more you are the exception, the greater the risk. So this is a very interesting way of trying to come up with psychological mechanisms or hypotheses for psychological mechanisms that may underlie some of the effects of the environment on a complex phenotype like schizophrenia and psychosis. So what about childhood adversity? This is the first meta-analysis that was published in 2012, where we really tried to assemble all the studies on trying to associate childhood trauma, childhood adversity with later psychosis outcome, be it at the level of schizophrenia or at the level of psychotic experiences in the general population. An interesting thing was that for all the different types of studies, so case control or population-based studies or quasi and truly prospective studies, the risk of the psychosis outcome associated with childhood adversity was about 3. So this is quite a high effect size for psychiatric epidemiology, and very consistent. And of course, there's always the risk of reporting bias in these types of studies, particularly in patients who already have a psychosis outcome. But of course, there's also truly prospective studies, like this study from New Zealand, from Australia, where there was really, where the authors were really able to link prospectively recorded cases of childhood abuse to later psychosis outcomes through population registers. So this is a truly prospective study that can't be biased by reporting of patients looking for an explanation of their predicament. So what might be the mechanisms of this link between childhood adversity and later onset psychosis? Because we know childhood adversity is associated with all sorts of psychiatric outcomes, from eating disorder to personality disorder to depression to anxiety, etc. So what might be the link between childhood trauma and psychosis? So Emmanuel Peters and many other in the United Kingdom particularly have again proposed a psychological mechanism so that individuals who've been exposed to interpersonal trauma, of course, have low levels of trust and may be prone to making paranoid interpretations, particularly of social interactions in the flow of daily life. This is a very interesting hypothesis, but difficult to examine. Because really what you would like to examine is how individuals over the course of a day, when they have all sorts of social interactions and meetings with other individuals, how they might frame these or interpret these in a slightly psychotic or paranoid fashion. And one way to examine this is really to try to examine, to follow experiences in the flow of daily life as they evolve in natural encounters with people in the natural environment using the experience sampling method. So the experience sampling method is really trying to do the same as, for example, ambulatory blood pressure measurement or ambulatory blood glucose measurement, plasma glucose measurement. Basically what it does is it tries to follow individuals 10 times a day at random moments, and through this app, for example, which beeps 10 times a day at random moments, you ask individuals to very briefly provide some input about the context, where they are, about positive affect, negative affect, and also about subtle experiences of aberrant salience or subtle psychosis-like experiences. So the great advantage of this type of methodology is that you do not ask individuals like questions like you would in a questionnaire, like in the last 2 weeks, on average, how would you react to minor stress in terms of negative affect? Because people don't know. They can't give an average of something that is very dynamic over the last 2 weeks. So the big advantage is that you have an intensive time series of experiences and context reported by people randomly in the flow of daily life, allowing you to link, for example, stress to negative affect, but also to follow rewards, like linking positive events in daily life to positive affect in daily life. And also how people react to social stress with aberrant salience or psychosis-like experiences, like a little bit of distrust or paranoia, or perhaps having unusual experiences, things that people can report in daily life. So what we tried to examine, this was in patients with a psychotic disorder. We tried to follow them using the experience sampling method. They reported daily social encounters, with people, and whether they developed, for example, subtle expressions of paranoia or unusual experiences. And then we tried to see whether this type of reactivity would be influenced by exposure to childhood trauma. And interestingly, using this methodology, there was separation in terms of how individuals reacted to social stress in daily life, with subtle psychosis-like experiences in the experience sampling paradigm. Those exposed to childhood trauma clearly had stronger reactivity to social context than the ones who were not exposed. So there was a differentiation using this subjective method. What you also want to examine this as an experiment, using an experimental paradigm. And you can do this, for example, by exposing individuals to virtual reality paradigms of social interactions. So this is work by Wim Veling in our group, who actually built a virtual reality social environment where all sorts of social interactions can take place, like people staring at you and sort of people doing strange interactions. And we had 170 individuals, controls, and patients with psychosis and patients at ultra-high risk, several levels of psychosis outcomes, and they performed stress experiments in the virtual reality environment. And we measured how these experiments were related to experiences of psychosis, like again, paranoia, unusual experiences. And then we tried to see whether it would again be separation as a function of whether or not individuals had had exposure to childhood trauma. And again, this is not yet published, this is submitted. Again, here we saw also in the experimental paradigm there was separation in terms of those having been exposed to childhood trauma and those not exposed, in terms of how they reacted with paranoia to social stress in the virtual reality environment. So these types of data, I think, tend to validate the underlying mechanisms, psychological mechanisms associated with exposure to childhood trauma, linking it to psychosis outcomes. But a much more difficult environment to study, of course, is what we call the urban environment. The urban environment is a very vague environmental exposure. We know that the urban environment is associated with higher rates of asthma and cardiovascular disease, and some types of cancer, and also higher crime rates in children. But it is also associated with higher rates of psychotic disorder. And this is interesting because there's some sort of specificity here in that the urban environment is not nearly as strongly linked to, for example, bipolar disorder. So it's rare to find this clear separation between bipolar disorder and schizophrenia, but it seems to be the case for the built environment. Now, there have been several studies looking at the effects of children growing up in the urban environment, because that seems to be the sensitive period. Researchers in Denmark actually calculated the sensitive period of urban environmental exposure between the ages of 5 and 15 years. These types of things you can calculate in Denmark because you got fantastic registers there and really a big broader system of following individuals over their life course. And the three studies in Israel, the Netherlands, and Denmark, all three studies found that the effect of the urban environment on later psychosis outcomes is greater if there's also evidence of genetic risk, in the sense of having a family history of psychotic disorder in the family. So this would be an example of gene-environment interaction, in that the purported environmental exposure, the proxy environmental exposure, the urban environment, because we think it's environmental, it's not a genetic effect, seems to be stronger if there's also evidence of genetic risk. So they seem to reinforce each other. This is a form of positive gene-environment interaction. So we wanted to take this further. And so we went to the city of Izmir in Turkey. Tolga Binbey from Izmir actually conducted this study. It's very interesting work they did there, because they examined the 400 different neighborhoods of this big city of Izmir. It's a city of about 4 million. And they examined the different neighborhoods in terms of of social stress, the type of deprivation, the type of social capital in these different neighborhoods. And they had the following hypothesis, very interesting hypothesis. The hypothesis was that the heritability or the level of familial clustering of psychosis outcomes would be low in neighborhoods that were low stress environments, and the level of familial clustering of psychosis outcomes would be higher in neighborhoods with high levels of social stress and deprivation. So this is actually what you would expect under the hypothesis of gene-environment interaction, because we know that if there's synergy between genetic risk and environmental risk, then the heritability of the disorder is higher in the high-stress environment compared to the low-stress environment. So this is the scenario you would expect on a gene-environment interaction. So very interestingly, they found exactly this, what confirmed the hypothesis. In neighborhoods that were more socially deprived and at lower social capital, the level of association between expression of psychosis in individuals at the level of subtle psychotic experiences, schizotypy if you like, and a family history of a psychosis outcome was higher in the deprived, socially deprived neighborhoods compared to the non-deprived neighborhoods. So this sheds some light, we think, on actually what may be the mechanism of this urban environment driving psychosis. It may be actually that if you're genetically vulnerable and you're exposed to a neighborhood where there's lots of social stress, then this genetic vulnerability may come to the fore, may become expressed more rapidly than if you live in a low stress and socially more coherent environment. Now, the other environmental factor that is much more easy to study is cannabis, because cannabis is we think, a biological exposure. It is not a psychological exposure, it's a biological exposure in the sense that you can study it at the level of marijuana and hashish and skunk types of cannabis, which have high levels of THC, which is particularly, for example, used in the Netherlands. So we know that there's an association between cannabis and psychosis, both from experimental randomized studies where cannabis is associated with acute psychotic outcomes, but we also know from long-term observational studies that there is a slight increase in the long-term associated between cannabis and psychosis outcomes, particularly with adolescent use and with daily use. And the type of strong cannabis like skunk, and the type of cannabis that is low in CBD, cannabidiol. So it seems to be that cannabidiol attenuates the psychotogenic risk of THC. But I think Marta Di Forti tomorrow from London will talk about this in more detail. So in the Netherlands, we conducted a study to examine this effect of cannabis, and also to examine whether you would find the same phenomenon, perhaps of gene-environment interactions, whether individuals who were genetically predisposed to psychosis would have a stronger psychotogenic effect of cannabis than those who were at low level, at low genetic risk. So this study was a large study of patients, but also of their siblings, their brothers and sisters without overt psychosis. This is an interesting group, of course, because these siblings are at higher than average genetic risk, but they don't have the outcome of schizophrenia or psychosis. So they're very interesting to use in a gene-environment interaction paradigm. So in these individuals, we measured the cannabis use and we measured the psychosis outcomes. Of course, psychosis outcomes in patients you can measure using things like the PANSS and measuring psychotic symptoms, but in siblings and in controls you can measure psychosis outcomes at the level of, for example, schizotypy, and do a schizotypy interview and measure soft expressions of psychosis proneness and psychosis liability. So what we examined very simply is this. We examined in the controls and the siblings of the patients, we examined the impact of cannabis on the expression of schizotypy. So how strong the association was between cannabis use and schizotypy in controls and siblings. And we found that in siblings there was a 10 to 20-fold stronger association, stronger impact of cannabis on schizotypy. So this seems to be, again, epidemiological evidence of gene-environment interaction. And of course, we've tried to find, in terms of which molecular genetic variations may mediate this gene-environment interaction. But this, of course, is very, very difficult. There's power issues, there's all sorts of methodological issues that you encounter. And there have been some findings. There have even been some replicated findings. I'm sure Marta Di Forti tomorrow will talk about this. But I'm not sure whether they're true findings. We need to replicate them. If they're replicated 10 times, I will come back to SOPSI and tell you about it. So the best way then to study the effect of the environment, I think, is not at the level of schizophrenia, when people already have developed the illness, but at a much lower, earlier level, namely when people make transitions from risk mental states to disease mental states. So for example, a very interesting transition paradigm is how people make the transition from neuroticism, the risk trait, to overt depression, or from trait impulsivity to addiction, or from behavioral inhibition to anxiety disorder, or from cyclothymia to bipolar disorder, and from schizotypy or low-grade psychotic experiences that you can measure in the general population to a psychotic disorder. This type of transition, I think, is a very fertile paradigm to study the impact of the environment and gene-environment interactions. So based on the epidemiological evidence, we've developed this model of how genes and environment may impact over development to cause these types of transitions. The hypothesis is that if this is, the y-axis here is the level of expression of psychosis, from subtle subclinical expression of psychosis pronus or schizotypy or psychotic experiences in the general population to strong expression of psychotic disorder. This is a sort of spectrum of expression of psychosis. Now, we hypothesized that in adolescence, there is this, epidemiological studies have shown that there's this blip, there's this increased expression of psychosis pronus. Adolescents have higher rates of expression of not just subclinical expression and anxiety, but also of subtle psychotic schizotypal experiences. We hypothesize that this is actually the, if you like, psychometric expression of distributed genetic risk of psychosis phenotypes in the general population. So this blip is normal and is transitory and is maybe the reflection, the psychometric reflection of distributed genetic risk for psychosis, because we know there's probably tens of thousands of risk variants, molecular genetic risk variants associated with the expression of psychosis. So we all have thousands or hundreds of these risk variants, and this may be the normal expression. We then hypothesize that if there is exposure to an environmental risk factor, then this normal transitory expression becomes more pronounced and more persistent. And if there's even more expression to environmental risk factors, there's more gene-environment interaction in the sense that there's more persistence and eventually development of a full-blown psychotic disorder. So this is the model which we have studied. And I'll give you evidence for the different parts of the model. First, is it true that this expression of psychosis pronus in adolescence, is that a reflection of genetic risk for psychotic disorder? So for this we went to Denmark, because in Denmark they had this wonderful birth cohort of 11-year-olds. It's a large birth cohort of 11-year-olds, and these 11-year-olds were interviewed by trained psychologists for the presence of subtle schizotypal psychosis-like experiences. And the prevalence of these types of psychotic experiences, so things like magic ideation or unusual perceptions, was about 11%. And then, because Denmark being Denmark, after this interview, we could link all these individuals in the birth cohort to the national psychiatric case registers, so we could trace all their first degree relatives through the national case register to see who had a history of treated psychotic disorder. So this is a wonderful thing you can do only in Denmark. What we found is this: if you look at the 3 types of outcomes we had measured in the children, presence of hallucinations in the children, presence of delusional ideation, and the combination, because we think the combination reflects a more severe pre-psychotic phenotype than just either hallucinations or delusions. I'll come back to this. So this is a family history of common mental disorder through the case register, and this is a family history of psychotic disorder. As you can clearly see, all 3 psychosis outcomes in the children, but particularly the combination of hallucinatory and delusional outcomes, was associated, strongly associated, with a family history of psychotic disorder chased through the register. So this, we think, is evidence that this broad phenotype of psychosis proneness in the general population has got something to do with a genetic risk for psychotic disorder. And then the second bit of the hypothesis: is it true that individuals with these subtle expressions of psychosis, if they have more exposure to environmental risk factors over development, that they have more persistence of this phenotype and that it becomes less transitory? So this we replicated in 2 general population cohorts, one in the Netherlands and one in Germany. These were longitudinal cohorts of individuals in the general population who had been assessed very carefully for the presence of subtle psychotic experiences. And what we found is the more exposure to environmental risk factors, like childhood trauma, urbanicity, cannabis, the greater the risk of persistence of subtle expression of psychosis over 5 to 10 years after the baseline interview. So it seems to cause persistence. And this work has now been replicated in other countries as well. It has been replicated particularly in the United Kingdom, in London, by several researchers in independent cohorts. And then, of course, the most important thing then, is it true that if there's more persistence over development in young people of this subtle psychosis proneness phenotype of psychotic experiences, is it true that if it persists over time, in this case over a period of 10 years, if it persists over the follow-ups, from follow-up to follow-up, is that a risk factor for the eventual transition to a psychotic disorder? And this we found here in the German cohort. So this was a 10-year follow-up, and this is the level of persistence from follow-up to follow-up. So the more the children and the adolescents had persistence of psychotic experiences, the greater the risk of making a full transition to psychotic disorder in adulthood. And this has also been replicated now in other cohorts in the world. So this, I think, is a very fertile way of trying to study in an epidemiological fashion gene-environment interactions. And the last bit I'd like to study is, since this is a congress on novel models of psychopathology, to show you a novel way of studying the effects of the environment and genes using novel phenotypes. In the sense that classically, of course, what we tend to do in terms of our phenotypic definitions in psychopathology is we tend to group people in categories of, for example, depression or schizophrenia, suggesting that they are similar because they have a similar type of disorder causing similar symptoms. So this is assuming that there are latent constructs of diseases that cause uniformly expression of symptoms. Of course, the other model, which is related but also competing, is that you don't group people into categories, but you group correlated symptoms into dimensions so that you can score people high or low on a certain dimension. For example, the dimension of depression or anxiety. This is a dimensional model. But if you like, the new kid on the block which is very much in line with our times, because we think now in terms of in networking, in genetics and in social sciences. You can also see the symptoms of psychopathology very much as not being caused by an underlying construct, but as causing each other in network of mutually impacting mental states. This, I think, is a very interesting model, because there's also some validity to this model according to statistical models of psychopathology. I'll give you an example. So some of you, for example, may recognize this, no? You're stressed, you're a little bit stressed, and then you don't sleep very well, and then the next day you're a bit irritable. Anybody recognizes this? Anybody ever? Yes, yes. But some of you may react differently. Some of you may have a different sequence. You may feel stress and you have insomnia, but then the next day you're not irritable, but you're a little bit hypomanic. Anybody? I know for certain Carlo Altomura actually has this sequence. And then maybe somebody has this sequence, no? From stress to insomnia, but the next day you're a little bit paranoid. That would be me, actually. So you can have different sequences. So this is a nice way of showing the network model. No? Something changes in the environment. It causes a change in your physiology, and that causes a change in your mental state. But it happens in a different fashion in different people. And there's a line of causal influences here. So psychosis, you can model psychosis perhaps also as a network where perceptual phenomena impact on your thinking, and your thinking impacts on your emotions, and your emotions impact on your perception and back on your thinking. So this is the network model of psychosis, and you can examine subsequently how, for example, genes and environments impact the connections between the mental states or the symptoms in the network. So this is a fairly novel model of psychopathology, but I think it's very promising, because you can feel it has a certain validity. It may not, of course, no model is the model. There's always categories, there's always dimensions, but looking at the network perspective can also help us, perhaps. So one thing we are interested in is this very simple model of, because we tend to say there's positive symptoms of schizophrenia, like this latent construct of schizophrenia is causing hallucinations and delusions. But that's a strange thought, perhaps, because hallucinations are completely different conceptually from delusional ideations, which are more cognitions, and hallucinatory experiences are more perceptions. So why would they travel together in a phenotype like schizophrenia? It is possible, for example, that they are not two symptoms of a latent disease, but it may be that they're connected to each other causally. For example, there's very old theories by Brendan Maher, for example, and by de Clérambault a century earlier in France, that actually some of the delusions that we see in patients actually are attempts to explain strange, unusual experiences, like hallucinatory experiences. So that some of the delusional ideations that people have are actually caused by hallucinatory experiences. So this type of connection is interesting because it generates hypotheses. And then you may hypothesize that actually genes and environments may impact on how these two are connected. So the hypothesis is that first, like Brenda Maher said in her hypothesis, psychosis, the ontogenesis of psychosis becomes more severe. The first severity of psychosis in the pathway to a full-blown psychotic disorder is when these two combine, when hallucinatory experiences become combined with delusional ideation. This should be a more severe phenotype, a pre-psychotic phenotype, than just hallucinations or just delusions. So this we examined. This has been replicated also several times now, because what you can do is you can go to the general population of people who are not yet ill, and then measure subtle expressions of hallucinatory experiences, unusual experiences at the level of schizotypy, or delusional ideations at the level of schizotypy, and individuals who have the combination, who have the connection. And then we try to see, in this case, for example, whether particularly this combination would be more severe in terms of how it would be associated with depression, or early expression of negative symptoms, or persistence, or dysfunction, or an interviewer saying, this person maybe needs help, or that the person was saying, maybe I need to see my general practitioner. So this clearly validated the hypothesis. For example, if you look at help seeking, those with the combination of delusions and hallucinations, where they become connected, had much higher rates of help seeking, thinking that they might need to see their general practitioner, and also that the interviewer who was interviewing these people said, I think this person may need a referral to a psychiatric department. So you can see that this maybe is an index of severity. So what we studied in our group sample is the siblings and the controls. And we studied in the siblings and the controls who were interviewed with measures for psychotic symptoms, for subtle expression of psychotic symptoms, and environmental exposures. We measured the degree of connection between hallucinatory anomalies and delusional meaning through these interviews. And the risk, you can assess this as a risk, express this as a risk from 0 to 100%, and then relate it to an environmental exposure. So what we found is that in the individuals who used cannabis, cannabis made the connection between these two stronger than individuals who were not using cannabis. So cannabis actually makes hallucinations and delusional ideation become more connected, therefore the pre-psychotic states become more severe. We saw the same thing for childhood trauma and, interestingly, a family history. So in the siblings had higher rates of connectedness between hallucinatory experiences and delusional ideation than the controls. So the genetic risk for schizophrenia may be the genetic risk of developing in an early phase more connections between early unusual experiences and making you more prone to come up with the delusional meaning to these. Okay, so this is actually a little bit about our research currently. So I think to wrap it up, what I think is important is that environmental impact can be studied both at the level of biology and meaning, and I think it is extremely difficult to study it at the level of biology. We are doing some epigenetic studies, for example, but epigenetics is famously difficult. It is very, very, very difficult. You can't access the brain. You can't use epigenetics in the brain. You want to see how it changes as a result of the environment. So it is interesting, but I think there's much more mileage currently in examining the meaning side of the impact of the environment, not just in classical models of psychopathology, but particularly in novel models of psychopathology, which are really agnostic and which study the impact of symptoms on each other in causal models, in causal network models. And of course, I haven't been doing these studies all by myself. We are a very large group at Maastricht University of seniors like Philippe de Lespaul and Peter van Harte and Ines Mien-Germijs and Jean-Paul Celte and a lot of the PhD students and statisticians that help us do this work. Thank you very much for your attention.